Welcome to Dr. Amanda Clarke, Heart Health and Cardiology. Today we are talking about the silent killer that is living inside nearly half of all American adults right now, and why most of them have absolutely no idea. Let us get into it. I want you to do something right now. I want you to think about the last time you had your blood pressure checked. Not last year, not sometime recently. Actually, think about the specific date, the specific number, the specific moment when a cuff was placed around your arm and someone looked at a reading and told you what was happening inside your arteries. If you cannot remember that moment clearly, if the number is fuzzy, if you are not entirely sure whether what you were told was good or just okay or something that needed attention, then this video is one of the most important things you will watch this year, because what I am about to tell you is not a collection of abstract medical statistics. It is the story of what is happening right now, today, inside the bodies of nearly 120 million Americans who are going about their normal lives completely unaware that a process of destruction is silently underway in their blood vessels, their heart, their kidneys, and their brain. A process that produces no pain, no obvious warning, no dramatic signal, and that ends for too many people in a heart attack or a stroke that arrives without warning and changes everything in a matter of seconds. High blood pressure is called the silent killer. That name is not dramatic. It is not designed to frighten you unnecessarily. It is simply the most accurate description of what this condition actually does. It kills silently. And today, I want to make sure that every person watching this video understands exactly how it kills, exactly who is most at risk, exactly what the numbers on a blood pressure reading actually mean, and exactly what you can do starting today to protect yourself and the people you love from something that is both extraordinarily common and extraordinarily dangerous. Stay with us until the very end because the information in the final section of this video is the most practical and the most immediately actionable, and it is the information that most people never receive until it is already too late. Let us start with the scale of this problem because the numbers are so large that they almost lose meaning. And that loss of meaning is part of the reason this condition continues to do the damage it does. Nearly half of all American adults, 47.6% to be precise, currently have high blood pressure according to the most recent cardiovascular statistics published this year. That is not nearly half of older adults, or nearly half of people who are obviously unwell. That is nearly half of all adults in the United States right now. Men, women, young, old, every demographic, every zip code. And of all the people in that group, only about 23% have their blood pressure adequately controlled. That means more than 3/4 of Americans with high blood pressure are walking around with a condition that is actively damaging their cardiovascular system, and are either not receiving treatment or not receiving treatment that is working effectively enough. Every single day in the United States, more than 1,000 deaths are associated with hypertension. More than 1,000 people every day. That is not a statistic from a distant past. That is the reality of right now. Today, in 2026, in the most medically advanced country on earth. Now here is what most people never find out. High blood pressure is not just one problem. It is the engine that drives almost every other cardiovascular catastrophe. It is the primary risk factor for stroke. It is a major contributing factor to heart attack. It causes heart failure by forcing the heart to work so hard against elevated pressure that the muscle eventually weakens under the strain. It damages the kidneys, which filter the blood and which are exquisitely sensitive to the pressure at which that blood is delivered. It contributes to cognitive decline and dementia by damaging the small blood vessels that supply the brain over years and decades. And it increases the risk of atrial fibrillation, the dangerous irregular heart rhythm we discussed in an earlier video, by causing structural changes to the heart chambers that disrupt the normal electrical system. High blood pressure is not a cardiovascular risk factor. It is the cardiovascular risk factor, the single condition that, when left uncontrolled, most reliably produces the full spectrum of cardiovascular catastrophe. And here's the thing that should genuinely stop you cold. A brand new survey published just days ago by a major research organization found that 60% of Americans say they are concerned about high blood pressure. 60% are concerned. And yet, nearly half of all adults already have it, which means that concern, however genuine, is not translating into action at anywhere near the rate that the scale of the problem demands. People are worried about high blood pressure in the abstract, while living with it in the specific. And that gap between concern and action is measured in strokes, in heart attacks, in kidney failure, in the kind of irreversible cardiovascular damage that changes lives permanently. Let me tell you about Karen. She was 52 years old, a project manager from North Carolina, someone who described herself as reasonably healthy. She exercised a few times a week. She did not smoke. She had a glass of wine occasionally. She was not dramatically overweight. By most outward appearances, she was doing reasonably well for her age. She had not had a physical examination in 3 years because nothing felt wrong and life was busy, and the doctor's office always seemed like something she could get to next month. When she finally went for a routine checkup, her blood pressure reading was 178/104. Her doctor looked at that number with visible concern and told her that reading was in the severely hypertensive range, not mildly elevated, not borderline, severely hypertensive. Karen was stunned. She had felt nothing, not a headache, not dizziness, not any sensation that told her something was wrong. Her doctor told her that, at that blood pressure level, she had likely been at elevated risk for stroke for some time. She was started on medication that day. And the first thing Karen told her friends when she got home was that she had no idea. She had absolutely no idea. Karen's story is not unusual. It is, in fact, one of the most common stories in American medicine. And what makes it particularly important is not just that she did not feel her high blood pressure. It is that, by the time most people find out they have it, they have already been living with it for months or years. The arterial damage that high blood pressure causes is cumulative. Every day that elevated pressure acts on the walls of blood vessels, it causes microscopic injury that accumulates over time. The inner lining of the arteries becomes progressively stiffer and less elastic. The walls thicken. The narrowing that results reduces blood flow to the organs that depend on those vessels. And the heart, forced to pump against that increased resistance day after day and year after year, remodels itself in ways that ultimately impair its ability to function. None of that happens suddenly. None of it announces itself. It builds quietly over time, and by the time symptoms appear, the damage is already significant. But here is something your doctor may not have had time to explain. There is a specific number range that most people do not fully understand when they look at a blood pressure reading. When someone tells you your blood pressure is 130/80 or 145/90, the numbers can seem abstract without context. So let me give you that context clearly. Blood pressure is measured as two numbers. The top number, called systolic, is the pressure in your arteries when your heart beats and pushes blood out. The bottom number, called diastolic, is the pressure in your arteries between beats when your heart is at rest. The current guidelines from the major cardiology associations define normal blood pressure as below 120/80. Elevated blood pressure, the stage that signals your arteries are under more pressure than they should be, but has not yet crossed into formal hypertension, is a systolic reading between 120 and 129, with a diastolic below 80. Stage 1 hypertension begins at 130/80. Stage 2 hypertension begins at 140/90. And a hypertensive crisis, a medical emergency that requires immediate attention, is defined as readings above 180/120. Now stop and think about what this actually means. Stage 1 hypertension begins at 130/80. That number is not dramatic. It does not feel dangerous. Most people who hear it do not feel alarmed. But that reading, sustained over time, is already beginning the process of arterial injury that leads to the outcomes we are describing. It is already increasing the risk of heart attack and stroke. It is already placing elevated demand on the heart, and it is already beginning the kind of damage to the kidneys and brain that will become clinically significant if the pressure is not brought under control. 130/80 is not fine. It is the beginning of a process that, without intervention, leads somewhere much worse. And this is the part that genuinely surprises most of my patients. The relationship between blood pressure and cardiovascular risk is not a threshold where you are safe on one side and at risk on the other. It is a continuous gradient. As blood pressure rises above normal, every increment of increase adds to cardiovascular risk. The risk at 140/90 is higher than the risk at 130/80, which is higher than the risk at 120/70. There is no number that is perfectly safe and no number above normal that is fully harmless. Every point of elevation matters, and every point of reduction produces real measurable benefit for the heart, the brain, and the kidneys. Let me tell you about David. He was 61 years old, a retired schoolteacher from Michigan, who had been told 5 years earlier that his blood pressure was a little high and that he should watch his diet and exercise more. He made some changes for a few months and then gradually drifted back to his old habits. He did not follow up. His doctor had mentioned it, but had not been alarming about it, and David, feeling fine, had not prioritized it. When David was admitted to the hospital after a stroke that left him with significant weakness on his left side, his blood pressure in the emergency department was 192/110. His doctors told his family that the stroke was almost certainly the result of years of uncontrolled hypertension. Years during which David had felt fine, during which his body had felt normal, during which the silent damage had been accumulating quietly and relentlessly, until it reached the catastrophic threshold that produced the event that changed his life in an instant. Here is the number that should concern every American watching this right now. Only 21% of people with hypertension currently have their condition adequately controlled. Only 21%. That means that 4 out of every 5 people with high blood pressure in America are not being managed effectively enough to prevent the cardiovascular damage that elevated pressure causes. Some of them have never been diagnosed. Some of them have been diagnosed but are not taking medication. Some of them are taking medication, but the medication is not bringing their blood pressure to target, and some of them are taking medication, achieving readings that look acceptable in the doctor's office, but whose blood pressure spikes at other times of day in ways that only home monitoring or continuous measurement would reveal. Each of those situations represents a different failure of the system and a different opportunity for intervention that is not being seized. But here is what the research actually shows about what happens when blood pressure is effectively controlled. The benefits are not modest, they are extraordinary. Reducing systolic blood pressure by 10 millimeters of mercury, which is the unit in which blood pressure is measured, reduces the risk of major cardiovascular events by about 20%, reduces the risk of stroke by about 35%, reduces the risk of heart failure by about 40%, and reduces the overall risk of cardiovascular death by about 25%. Those are not marginal improvements at the edges of outcomes. Those are dramatic reductions in the most serious cardiovascular consequences that uncontrolled blood pressure produces. 10 millimeters. That is the difference between a 140/90 reading and a 130/90 reading. That single meaningful reduction in a number that most people do not think about from day to day produces those extraordinary reductions in risk when it is sustained over time. Now let us talk about something that the survey published this week touched on, and that deserves much more attention than it typically receives in the clinical conversation about blood pressure management. Diet, specifically the role of specific foods in either elevating or reducing blood pressure. The survey found that 65% of Americans are willing to try a plant-based diet to reduce their blood pressure risk, and 64% are willing to avoid foods high in saturated fat. Those numbers represent genuine openness to dietary change, and the science strongly supports the idea that dietary change can produce meaningful reductions in blood pressure even without medication in the early stages of hypertension. The most extensively studied dietary approach for blood pressure management is called the DASH diet, which stands for Dietary Approaches to Stop Hypertension. It emphasizes vegetables, fruits, whole grains, lean protein, and low-fat dairy while limiting sodium, red meat, sweets, and sweetened beverages. Clinical trials of the DASH diet have consistently shown reductions in systolic blood pressure of 8 to 14 millimeters of mercury in people with hypertension. That is, a reduction comparable to what many blood pressure medications achieve. Not all of it. Not a replacement for medication when medication is needed, but a meaningful and real reduction that demonstrates the genuine power of what you put in your body to influence the pressure at which your blood flows through your arteries. Sodium specifically deserves particular attention because the relationship between sodium intake and blood pressure is one of the most consistently demonstrated relationships in nutritional research. Most Americans consume significantly more sodium than the recommended amount. The excess sodium causes the body to retain water to maintain the proper concentration of electrolytes in the blood. That retained water increases the volume of blood in the circulatory system. And increased blood volume means increased pressure in the arteries. Reducing sodium intake, for people who are sodium sensitive, which research suggests includes a significant proportion of people with hypertension, can produce meaningful and relatively rapid reductions in blood pressure, not by eliminating sodium entirely, but by reducing consumption of the processed foods, canned goods, restaurant meals, and packaged snacks that are responsible for the majority of excess sodium in the American diet. The survey also highlighted 2 specific foods that research has associated with blood pressure reduction: bananas, which are rich in potassium, a mineral that helps counteract the blood pressure-raising effects of sodium and that supports healthy blood vessel function, and beets, which contain naturally occurring compounds called dietary nitrates, that the body converts into nitric oxide, a molecule that relaxes and dilates blood vessels, and thereby reduces the pressure at which blood flows through them. These are not miracle foods. They are not going to cure stage 2 hypertension on their own, but they are real foods with real mechanisms of action that contribute meaningfully to a dietary pattern that supports healthy blood pressure alongside the broader lifestyle changes that effective blood pressure management requires. Ask yourself honestly right now, how much sodium are you eating each day? Do you know? Most people do not. Most people vastly underestimate their sodium consumption, because most of the sodium in the American diet is not in the salt shaker on the table. It is in the bread, the canned soup, the restaurant meals, the frozen dinners, the condiments. It is in foods that do not taste salty, but that contain remarkable amounts of sodium. If you have high blood pressure, or elevated readings that are approaching the hypertensive range, spending 1 week actively reading sodium labels and tracking your intake is one of the most enlightening things you can do for your health. Not permanently, just 1 week to understand where your sodium is actually coming from. That knowledge alone has the power to change your choices in ways that change your numbers. Let us talk about what else matters for blood pressure beyond diet, because the lifestyle factors that influence blood pressure are well established, and the evidence for their effectiveness is strong. Regular physical activity is one of the most powerful blood pressure-lowering interventions available outside of medication. Regular aerobic exercise, meaning the kind that raises your heart rate, performed for at least 30 minutes on most days of the week, reduces systolic blood pressure by an average of 5 to 8 millimeters of mercury in people with hypertension. That is significant. That is meaningful. That is the kind of reduction that translates into real reductions in cardiovascular risk when it is maintained consistently. You do not need to run marathons. You do not need to join an expensive gym. You need to move your body in ways that challenge your cardiovascular system on a consistent, regular basis. Sleep matters more than most people realize for blood pressure regulation. Research has consistently shown that poor sleep, both in terms of duration and quality, is associated with higher blood pressure. The mechanism involves the stress hormone cortisol, which rises when sleep is inadequate, and which raises blood pressure through multiple pathways, including direct effects on the arteries and activation of the sympathetic nervous system. 7 to 9 hours of quality sleep is not a luxury. For your cardiovascular system, it is a physiological necessity. Stress management is another factor that receives far less clinical attention than it deserves. Chronic stress activates the body's stress response systems in ways that consistently elevate blood pressure over time. The relationship is not just about acute stress raising your blood pressure in the moment. It is about the sustained activation of stress response systems that comes with the chronic stress of modern American life and the toll that sustained activation takes on arterial health over months and years. And weight. For people who are significantly overweight, losing even a modest amount of weight, 5 to 10% of total body weight, produces meaningful reductions in blood pressure. The relationship between excess body weight and blood pressure is direct and well established. Fat tissue, particularly the kind that accumulates around the abdomen, produces hormones and inflammatory signals that raise blood pressure through multiple mechanisms. Reducing that tissue load reduces those signals and gives the cardiovascular system relief that shows up directly in blood pressure readings. Here is the most important thing I want you to take away from everything we have covered today. High blood pressure is treatable. It is manageable. The damage it causes, when caught before it has produced catastrophic events, can be stopped and in many cases partially reversed. Medication, when it is needed, is safe, effective, and for most people well tolerated. Lifestyle changes, when they are made consistently, produce real and meaningful reductions in blood pressure that reduce cardiovascular risk in ways that translate directly into longer and healthier lives. The technology for monitoring blood pressure at home, for tracking readings over time, for communicating those readings to healthcare providers has never been better or more accessible. The barriers to managing this condition effectively have never been lower. What stands between most Americans and effective blood pressure management is not the absence of effective treatments. It is awareness. It is the willingness to check the number, to take the reading seriously, to follow up when a reading is elevated, to make the lifestyle changes that evidence shows can make a real difference, and to take medication when medication is what the situation requires without the stigma or the resistance that leads too many people to leave blood pressure pills on the shelf. When did you last have your blood pressure checked? If the answer is more than a year ago, please make an appointment this week. Not next month. This week, the reading takes 2 minutes. The information it gives you is among the most important health information you can have, and acting on that information, whatever it shows, is the single most powerful thing most Americans can do right now to protect their hearts, their brains, their kidneys, and their lives. If this video gave you a genuinely clearer and more complete understanding of what high blood pressure actually does, why it is so dangerous, and what you can do starting today to protect yourself and the people you love, subscribe to Dr. Amanda Clarke and turn on notifications so you never miss a video that matters for your health. And drop a comment below answering this question honestly. When did you last have your blood pressure checked? And if you have been told your blood pressure is elevated, what has been the biggest obstacle to addressing it? Every comment matters, and your honest answers help us understand what this community needs most.